interrelationship early on in life and also develop healthy social relationship with your friends in the community where you are living, it's actually, they both constitute a protective factor for adult mental health. Young Lives is the longest running longitudinal studies in the global south. And it was set up at the beginning of the millennium with the mission of looking at and investigating the consequences of growing up in poverty in the 4 low and middle income countries that Kat just mentioned. And the idea was basically the study was going to provide robust evidence to influence policy and practice. So Young Lives is an example of a very specific longitudinal study. It is a cohort study, which means that it follows a group of people who were born in the same year. And you will see in a while why that's important. So at the heart of the study, there is this amazing longitudinal data set that is tracking the life of the 12,000 children in Ethiopia, Peru, India, and Vietnam. And more specifically, what we are doing here is we are following 2 cohorts of children born 7 years apart, with a younger cohort that is followed since age 1 up to age 22, and the older cohort from age 8 to age 29. And importantly, Young Lives is a mixed method study, which means that in parallel to these fantastic data sets, we do conduct in-depth interview and focus group with a subset of the 12,000 participants involved in the main part of the study. So one thing that Young Lives has been able to do over time is to keep our participants engaged, which is reflected by a very low attrition rate. What that means in practice is that we have been able, in the latest survey rounds that was conducted in 2023-2024, to track and interview more than 81% of the original sample 20 years earlier. And that has been quite a challenge. What you see here on the right-hand side is the 2002 map of Peru, and the dots are the community where the Peruvian participants of the study were living. 20 years later, in 2023, you can see that the participant has been moving around quite a lot, which, as you can imagine, is a challenge for us to follow them and to be able to locate them and interview them. So in today's presentation, I will use some example from the Young Lives research and the Young Lives studies to demonstrate the unique value of longitudinal research, and also to show how that's critical for shaping the national and international policy debates. And hopefully toward the end, I will let you know or try to make the case what is the significant potential for the study, how we can contribute moving forward. So one of the key aspects for longitudinal cohort studies that they do help in tracking the human development through different aspects. And specifically, I will focus on some example on nutrition and subjective well-being and mental health for today. And over the past 20 years, what we have observed across the 4 Young Lives countries is that there has been an improvement in standard of living. And that means different things depending on what you are interested in looking at. But we still see that there are a lot of pockets of inequality and pockets of hardship. As the participants begin their adult life, the study is discovering that how their childhood nutrition has been affecting their physical, mental health development, their learning outcome, their transition to education and to the labor market. What we observe overall that there has been a significant decrease in undernutrition. But look at this example. This is an example from India. What you see on the red line is the percentage of participants that are undernourished, and what you see in the green line is the percentage of participants in India that are overweight. So it's quite clear that while there has been a slightly decrease in undernutrition in India, there has been also an increase over the life course of our participants in overweight and obesity, which brings us to what is defined as a double burden, where you have the coexistence of undernutrition and overweight and obesity. Now, when you start looking into what happened and what are the key drivers hidden in those statistics, you clearly see that why undernutrition is something that is still prevalent among the poorest segment of the population. Overweight and obesity is more prevalent within the richest or least poor population. That's what you see here. In the green dotted line is the top tertiles, which are the least poor, while the red line, the solid red line, is for the poorest one. And you'll see that for undernutrition, the red line is always over the dotted line, while for obesity, the opposite is true. Now, when we look at subjective well-being, and subjective well-being is basically a measure of to what extent our responders are satisfied with their life. What we observe here is that while there has been an increase in subjective well-being when we compare our two cohorts over time, during the pandemic, there has been a massive drop in subjective well-being, which is also reflected on the higher prevalence of mental health challenges faced by our respondents. And there has been an improvement post-COVID again, and in some cases, in the case of India, they basically fully recover from the shocks during the pandemic period. Now, one other reason why longitudinal studies are important is that longitudinal studies are essential to understand what is the impact of shocks and crises during the life course. And despite this importance, there is still a significant lack in population-based evidence alongside telling you more about how crises and shocks affect human development, which could be nutrition, could be cognition, could be mental health, transition to education, and labor market. Young Lives is uniquely positioned to actually fill up this gap. And as I mentioned before, recently we witnessed a dramatic increase of mental health challenges during the COVID pandemic. And I copy and paste here some images of recent publication on this specific topic. And what we observe is that there has been quite a significant increase on anxiety. This is a figure for anxiety. So this is the prevalence of respondents reporting symptoms that are compatible with at least mild anxiety, but similar figure would be for depression as well. And Peru has been the country that has been affected by the COVID the most, both from a health perspective and also for the impact that the prolonged lockdown had on the economics of the country and disrupted education, etc. And it's still the country where we register the highest level of anxiety, and the same for depression, which suggests that the effect of the pandemic, or the pandemic had an effect both on the short term but also on the long-term mental health of our respondent. So, and when we start trying to understand what is behind that, so what are the key protective and risk factors for mental health, Young Lives offer a unique opportunity because Young Lives is a holistic study. So it's looking at the life of our participants from different perspectives, from education and skills perspective, from health and well-being, what they are doing with their family lives, whether they get married, they have kids, how they are doing in their labor market once they drop out of the live education. So what we saw from our research is that having strong parental relationship early on in life and also develop healthy social relationship with your friends in the community where you are living, it's actually, they both constitute a protective factor for adult mental health. While on the other side, the key risk factors that emerge are around food insecurity, which has been recently exacerbated by the COVID pandemic, but more generally coincide with period where our respondent has been exposed to extreme environmental shocks or job losses as a major source of anxiety, and that's one of the evidence emerging during the pandemic research period, or other more general financial worries, increased healthcare costs, long-term health problem. All of these constitute risk factor. In the case of Ethiopia, there is this quite peculiar evidence on the effect of interrupted education has been one of the driven factors for an increase in anxiety among women. And you will see in a second that also the conflict matters quite a lot. So how crises and shocks coexist and intersect, and to what extent multiply the effect of one another, it's quite clear in this example for Ethiopia. So in Ethiopia, during round 7, there was and there is still an ongoing armed conflict, and part of our respondents were living in the Amhara region, and we have been unable to locate and interview them in person for obvious reason. So we have to reach them out over the phone. And these are the two first bar here, which are the prevalence of at least mild anxiety in those respondents, among those respondents living in the most affected region. So the most affected region by the conflict were those where we registered the highest prevalence of mental health challenges. And the highest prevalence and also the highest increase from 2020 to 2023-24. Now, when we talk about shocks, what we have been doing is linking the Young Lives data with rainfall data. And what we found is that early exposure to rainfall shocks has had profound effect on children's physical growth. And this effect also transmits from mother to kids. And that's really, it's one of those evidence that really surprises you and blow your mind, because you can imagine that children born to mother who were exposed to the famine or who were exposed to drought tend to be shorter or underweight, stunted, more likely than their peers living in different conditions. So there is this element of intergeneration transmission of poverty, broadly speaking, from one generation to the other one. And we also know that being exposed to shocks, even during the gestational period, has an impact on nutrition, but also has an impact on cognitive skills formation, and specifically has an impact on foundational cognitive skills, which are the building blocks of cognition process and has been found to be predictor of educational outcome and learning outcome. And we know that at least part of the impact that being exposed to environmental extreme has on foundational cognitive skills go through the nutrition. So you are exposed to shocks during the gestational period, that affect physical growth and nutrition, and that has an impact on foundational cognitive skills formation that eventually impact your education and transition to the labor market. So as you see, having both an holistic approach and having information about this different dimension and having a life course approach, that's very important and crucial to get to this conclusion. And then finally, what we found, which is very interesting, is that being exposed to shocks, environmental shocks, has an impact on nutrition, foundational and cognitive skills, but also on social-emotional functioning and eventually mental health. That is also persisting into adulthood. Now, on the positive side, one thing where longitudinal research can be very useful is to understand where to intervene and when to intervene and who should be the target of any potential policy intervention. And by collecting information over time, on the same individual over time, longitudinal studies go beyond simply identify how many persons suffer from that specific problem or are affected by a specific shocks, and try to understand better what are the root cause of what you observe, and also when to intervene and who to intervene onto. So on our own evidence suggests that impact of climate shocks and being exposed to shocks more generally are not irreversible. And our evidence shows that early childhood stunting can be reversed well beyond the first 1,000 days, which is what is established by the current literature. And physical recovery, when that happens, is also linked to significant improvement on cognitive skills for the same reason I mentioned before. So there is space for social protection program to intervene and remediate partially or fully for what the consequences of growing up in poverty or experience the brunt of environmental extremes and shocks or crises more generally, well beyond the first 1,000 days. Now, Young Life's mission has been since the beginning not just to collect data, produce evidence, not just to inform, but also to transform. So it has been in the DNA of the program to actually produce robust evidence that were informing policy and programs. And as you can imagine, being on the ground for over 20 years, that means that the study has been able to create a wide network of partnership, both in the country study, where our country partner has been very critical in this respect, but also internationally. So we have been contributing with our evidence on informing the massive expansion of pre-primary education in Ethiopia. We have been informing one of the biggest social protection program in the same country. Most recently, our evidence has been directly cited in a new legislation prohibiting child marriage in Peru, and we have been receiving two quite prestigious awards within the University of Oxford very recently. And again, that's a recent impact that the study had. The Young Life's evidence were directly cited that informed the life course approach, holistic approach of the new WHO guideline on mental health. Now, as I said at the beginning, Young Life is a mixed method study. So our evidence, and most recently evidence that we collect thanks to the support of the Wellcome Trust Foundation around mental health and the lived experience, has been telling us why our Peruvian respondents, and specifically Peruvian women, has been struggling with mental health issues as a consequence of the COVID pandemic. And we discovered through in-depth interview that the lack of social protection, the barrier that they faced when they were trying to access high-quality mental health care services, but also the social stigma around suffering mental health issues, has been recognized from them directly as the key obstacles to be healthier. Now, looking forward, what we are looking into now is trying to leverage on the 25 years of data collection to understand what are the risk and protective factors for exactly as Kat was saying. By doing that, what we can do is intervene early, identify those who are at risk of mental health challenges as an adult, etc. So we, as part of the latest survey rounds, we did collect air sample as a measure of cortisol, which can eventually help in us to understand how cortisol level can actually correlate with other mental health screening measures, but also to what extent early inequalities or the experience of poverty during childhood can actually have long-term impact on how we do react to stressful situations as adults, and to what extent stress level actually affect behavior and physical health. So what we are looking into is using our data to identify the key life course factor and pathway to mental health. And we have the advantage of having an holistic approach in place, building on life course data, so we can look at different elements from biological relationship within the family, peer relationship, the context where they were living, their experience of event and shocks, and try to understand how those elements matter the most and where are the windows of opportunity where we can intervene and prevent mental health issues during adulthood. From a climate perspective, we recently launched a new research hub on climate change and environmental shocks. And what we are doing here is matching our Young Lives data with environmental data to understand to what extent our respondents they have been living in circumstances where air pollution increased, rainfall shocks has been their daily experience, or they have been exposed to high temperature, as Kat was mentioning before, for another study. And what we can do with Young Lives data that cannot typically be done with other data sets is we can look at the long-term impact of shocks experienced early on in life, but also at the prolonged effect. So if you have been exposed multiple times to different shocks during the life course, what is the impact on a number of elements or part of what is defined, broadly speaking, human development, and how the exposure to different shocks, including environmental shocks, but also conflict-related shocks, economic shocks, might actually interact with one another. And just to conclude, the reason why we are doing that, and specifically focusing on increasing air pollution, rainfall shocks, and high temperature, is that when we look at our country and how air pollution change over time, this is a map from Ethiopia. You have the map from 1998 and the map from 2022. So it's quite clear when you see red, you see bad things. There has been a huge increase in air pollution, even though there are geographical differences that we can actually exploit for our analysis, and similar figure when you look at the other country. This is an example for India. So we know that being exposed to air pollution has a number of effects on the way that's affect your cognition, your nutrition, your mental health. So that's something that the hub is trying to do.
So my first question is that Young Lives is focused on low and middle income countries and marginalized communities within them. Why is it important to make sure that we have diverse populations in our longitudinal population studies? Let's start with Marta.
Thank you, Kat. So I think it's two questions in one here. And the question is, we have to have enough data, longitudinal study that are covering the diversity across country, because when we talk about low and middle income country, we'd effectively talk to a variety of challenges that each country actually have to face. And then when we look in the country, the specific country we are interested in, we have multiple challenges that different populations are facing. And in fact, having a sample that covers the diverse population in that specific country is very important for that reason. And that's also why back in 2001, when Young Lives was created, there was the objective to have a pro-poor sample, which means basically oversampling the poor segment of the population to have enough information from the population that we care about, because the study was set up to look at the cause and consequences of growing up in poverty and the inequalities in each one of the contexts. But at the same time, what you want to actually get out of the research done with the data is having universal lesson that can be applied outside of the specific context. And actually, when that's the case, it gives you more security of the evidence that you found. So what is called external validity is really important. So you want to have granular information on covering the diverse population within the country, but at the same time, from the data that you have driven universal lesson that can be used and applied to different contexts.
Thanks. I'll just ask one quick question before we turn it over to the audience. So we know that longitudinal studies involve tracking people over time. I think you were saying Young Lives has been going for 2 decades. How do you keep people engaged over that time? How do you retain them in the study, and what's in it for them?
Yeah, that's a very good question. So I think there are 3 elements here to take in consideration. When you want to maintain your participant as part of the study, you have to reduce refusal, so keep them engaged into the study. Reduce attrition, which means being able to locate them and knows where they are living, where they are moving to, and then keep engaging them during the interview as well. So the average duration of a Young Lives interview is around 2.5-3 hours. So you want them to be engaged from the beginning to the end of the interview. So on reducing the refusal, I think the study has been particularly good because our fieldwork team has been in place since most of them, or many of them, since round 2, which is back in 2006. So they knows the family, they knows the community, they knows their peers, they have contact, and they built a trustful relationship with our respondents. In terms of locating them, one thing that now is very handy with the new climate hub is that we have been very good at tracking their location over time. We have been collecting GPS coordinates for the household where they were living, the community where they were living, but also in between round we have been asking information about movement. So if they have been migrated temporarily to a different community, we would know that. So we have the location. We pretty much keep good track of them. And keeping engaging during the interview, we typically start the interview from the most challenging modules, which typically are asking questions about their education history, what you were doing the year before and the year before that, etc., or what sort of shocks affected you or your household during the 3 years time gap during the survey rounds. And then we move to the easiest or funnier modules, and typically we end up with collecting anthropometrics, which is something that, believe it or not, they like to do, or playing games in the tablet to measure foundational cognitive skills, working memory. So these are the most enjoyable parts. So we are very conscious when we build the survey to make sure that we have a good path into the survey to keep them engaging from beginning to start. We do have a country partner in each one of the countries, which one of their main tasks is actually to help us to reach out for the relevant ministries, for example, that usually we run some consultation before in the design phase of the survey to understand what is the demand from the country perspective, what are the topics that are of interest, where there are a lack of data, what they want to know better. So when we get the data and doing the research that we need to do, we have answers that are meaningful for them. So it's what we call is a demand-driven survey. So the Young Lives data are open access, meaning that they are all accessible to the global community of researchers or different sort of stakeholders in country internationally. And they are in the UK data service, in the UK data archive. The way that we have been working with our country partner, I mean, Kat already says we are involving them very much into the policies, which is the last step really in the entire cycle. But we have been working closely with that, hands to hands on the design of the survey, and then the analysis. Well, they are taking care of the data collection most. That's their main, their main responsibility, and then we have researchers working from the country partner that are contributing to the research side as well. So yeah, the answer is yeah. So typically what we do as well is running data workshop in each one of the country to involve the local community of researchers, students, when our partner is based in the university, for example. In the case of Ethiopia, we had quite a bit of that. So there is very much a full involvement of the researcher from the south in all the phases of the studies. And as I said, it's open access. So you can, apart from personal data information about the location of the participant that need to be protected, the rest is available for everyone.
What a fantastic resource Young Lives is, and how proud Wellcome is to support it. It has such a holistic approach. It exemplifies so many of the principles that we sort of hope to uphold at Wellcome, particularly the support of this rich data collection in low and middle income countries. So thanks so much.